What's the one feeling that can ruin a perfect day? It often starts as a tiny tickle, a slight scratchiness at the back of your throat. Before you know it, every swallow feels like you're swallowing sandpaper. We've all been there. The dreaded sore throat. It's one of the most common reasons people visit a doctor. But what if I told you that in the vast majority of cases, the culprit is a specific type of uninvited guest, and the battle plan to defeat it is probably already sitting in your kitchen cabinet? Today, we're pulling back the curtain on the number one cause of sore throats. It has a fancy, medical name, acute viral pharyngitis, but you can just think of it as the common sore throat. We're going to understand who the villain is, how to spot it, and how to become an expert at soothing it right at home. So, let's break down that name. Acute just means it comes on suddenly. Pharyngitis is the medical term for an inflamed pharynx, which is the technical name for your throat. And the most important word, viral. This means the whole thing is caused by a virus. Think of your throat as a calm, peaceful neighborhood. A virus, like the common cold virus, adenovirus, or even influenza, is like a rowdy party guest that shows up uninvited. It crashes the party, makes a huge mess, and irritates everyone. That irritation and mess is the inflammation that makes your throat red, swollen, and incredibly sore. This isn't a bacterial infection, it's a viral invasion. So, how do you know if this particular villain has set up camp in your throat? There are some classic telltale signs. First, of course, is the pain. It can range from a mild scratchiness to severe pain that makes talking or eating a chore. You might look in the mirror with a flashlight and see that the back of your throat is red and angry looking. But here's the biggest clue. Viruses rarely travel alone. They almost always bring their gang of friends with them. If your sore throat is accompanied by a cough, a runny or stuffy nose, sneezing, or watery eyes, you are almost certainly dealing with a viral infection. These other cold-like symptoms are the calling card of a virus. So, you've identified the enemy. It's a virus. Now for the battle plan. And here is the most important rule of this fight. Antibiotics are useless here. Antibiotics are designed to kill bacteria. Using them against a virus is like trying to use a key to open the wrong lock. It simply won't work, and it can contribute to bigger problems like antibiotic resistance down the road. Your body's immune system is the true hero of this story. Your job is to be its support crew. And here's how you do it. First, hydration is your superpower. Your throat is irritated and dry, so keeping it moist is key. Drink plenty of fluids. Water is best, but warm, soothing liquids are fantastic. Think caffeine-free tea with a little bit of honey, which has natural soothing properties. A warm broth or soup can also feel amazing. Next, bring in the classic home remedy, the saltwater gargle. It's not just an old wives' tale, it actually works. Dissolve about half a teaspoon of table salt in a full glass of warm water. Gargle for a few seconds, then spit it out. The salt helps to draw out excess fluid from the inflamed tissues, which can temporarily reduce the swelling and pain. Think of it as giving your throat a soothing, cleansing bath. Third, control your environment. Viruses love dry air, but your throat hates it. Using a cool mist humidifier, especially in your bedroom at night, can add moisture to the air and prevent your throat from getting painfully dry while you sleep. And finally, the most underrated weapon in your arsenal, rest. Remember, your immune system is fighting a war. If you're running around, stressed and exhausted, you're diverting resources from the battlefield. Resting allows your body to focus all its energy on evicting that rowdy, uninvited virus. Now, we have to talk about the red flags. While most sore throats are viral and will clear up on their own in about a week, you need to know when to call for backup. You should always see a doctor if your sore throat is unusually severe, if you have difficulty swallowing or even breathing, or if it's accompanied by a very high fever. Another major red flag is if you see white spots or patches on your tonsils. That can be a sign of a bacterial infection like strep throat, which does need antibiotics. If your sore throat lasts longer than a week with no improvement, it's also time to get it checked out. So let's bring it all home. The next time you feel that familiar scratchy feeling, don't panic. Take a deep breath and assess the situation. Is it traveling with its gang of cold symptoms? If so, you're likely dealing with acute viral pharyngitis. You are not helpless. You are the support crew for the most powerful fighting force there is, your own body. Soothe it with warm liquids, cleanse it with a salt water gargle, and give it the rest it needs to win the fight. Most of the time, the battle will be over in just a few days. And knowing that is powerful medicine.